Receiving a diagnosis of prostate cancer can literally blindside men and their loved ones. An immediate instinct is often one of panic, wanting to jump right into treatment without carefully weighing all the options. So far in the Prostate Health Podcast, we have visited with many experts, leaders, and innovators regarding various prostate cancer treatment options. You will definitely want to listen in because today, for the first time, we will be bringing on the show prostate cancer survivor Gogs Gagnon to share his story. So listen in. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. It is a pleasure to introduce to our Prostate Health Podcast nation today, Gogs Gagnon. He is a prostate cancer survivor who was diagnosed and treated for prostate cancer in 2017. After his surgery and recovery, he decided to share his story by writing a book named Prostate Cancer Strikes, Navigating the Storm, which has helped inspire others to advocate for their health and learn from his experiences. He is also a prostate cancer advocate and has created a YouTube channel capturing the details of his diagnosis, has developed a website and blog, and is active in various prostate cancer support groups. He is a member of the Prostate Cancer Foundation of British Columbia Support Group Council, and most recently took on the role as a content creator for prostatecancer.net. I have known Gogs now for over a year, where our paths initially crossed on social media as prostate cancer advocates. Since then, I've had the opportunity to read his book, as well as provide a testimonial on its impact it has had on affected men and their loved ones. Gogs, welcome to the Prostate Health Podcast.
Thank you very much, Dr. Bowman. It's a pleasure to be here.
First off, I thought you could share with our listeners a bit about yourself and your background.
Absolutely. Well, once again, my name is Gogs Gagnon, and I was born and raised in New Westminster, British Columbia, Canada. And I basically had a very typical childhood, although I was very interested in technology and electronics. And I tell you, when the Apple computer first came out, I was just in heaven. So I purchased one and spent all my time on it and went to college, took every course I could find, ended up getting a diploma in computer science. And I got a job working for Apple Computer developing games, which was a lot of fun. And I also got a job working for IBM in the early days, working on a lot of software for their early PCs. Eventually took a job with the government of British Columbia. I worked there as a lead programmer and data architect for 35 years before retiring. Even though I'm retired, I still take on the contract here and there because technology has just been so wonderful for me, and I've just been addicted to it ever since that computer came out.
Well, we really appreciate you coming on the show. So where did your prostate cancer story begin?
It all started back probably when I was in my early 50s. My doctor recommended that I have annual physicals, just head-to-toe checkups. And so I started doing that. I thought that was a good idea. And I would have annual blood work and annual physical. And one of my appointments, my doctor recommended to include the PSA blood test. Now, I was already getting blood work for a number of other reasons, cholesterol, et cetera. And I thought, well, why not? It's just another thing to measure. Well, let's throw that in the mix too. So I took my requisition off to the lab, gave a few vials of blood. And a few weeks later, or a week later, I was back in the doctor's office to look at the results. And he was quite happy with everything. He said all my numbers were in a nice normal range. Everything's looking very good, healthy. Except my PSA was slightly elevated, he said, 4.1. Although he wasn't too concerned because it was my very first reading. And he said that, there's other possible reasons why a PSA level might be high. And he mentioned that recent sexual activity might be one. And I thought, well, that obviously must be the reason. So he just recommended that I have another PSA test in 3 months. and hold off on any sexual activity a few days before the test. In the meantime, he gave me a digital rectal exam, and he said my prostate was enlarged, but it was very smooth, and the tissues seemed very healthy. And he said that, as men aged, prostates typically also enlarge as well, so he wasn't too concerned. So off I went, and 3 months later, I had another PSA blood test, and the results came back even higher. So he was starting to get a little concerned, and he did another digital rectal, and again said it seemed smooth and healthy. But he recommended that I see a urologist just to get some thoughts on that. So about a month later, I was in the urologist's office, and he asked me all kinds of questions about my health, and I wasn't having any health issues at all. I had no symptoms. I was sleeping through the night, no trouble going to the bathroom, no trouble with erections. So he did a digital rectal exam and basically confirmed the same thing, enlarged prostate, but very smooth. So he recommended another PSA test. So I had another PSA test, and again, the results were even higher. So this time, the urologist recommended that I have a prostate biopsy. And this is when you start to get a little concerned as a patient, and you start to do a little research, and you start learning a little bit more about, prostates and prostate cancer and prostate biopsies. And so I went in for my prostate biopsy, and the results came back negative, no cancer. Now, as a patient, you learn as you go. And I kind of assumed at that time that the fact that the biopsy was negative, that I didn't have any cancer. And I also didn't realize at the time, too, that the biopsy was what they call random or blind, where they typically just take samples from the prostate where cancer is most likely to be found. So I was quite happy with the news and thought, okay, I'm good to go. But I'm very thankful for my doctor. He recommended that I continue with the PSA testing anyways. And maybe not every year, maybe every 6 months, just because mine's been rising, just to keep an eye on it. And I thought, okay, let's do that. And the years go by, and my PSA was measured about 14 times over 5 years. In every case, it was higher. And so about 5 years later, my wife and I had moved at that time, and we had to find new doctors. So I found a new doctor, and I was having my annual physical, as I did every year. And she was reviewing my charts and was a little concerned to read where my PSA was rising steadily for 5 years. And she noticed that I had a negative prostate biopsy, so she recommended that I see a urologist and talk about this. And then again, she did a digital rectal exam, and she confirmed the same thing. Nice and smooth, seems very healthy tissue. So off to a new urologist I went, and he recommended that I have an MRI. And that's something that I knew what MRI was, but I was thinking, well, that makes sense. Why don't we have an MRI, nice three-dimensional picture of the prostate. So I went in for the MRI, and the results came back. There was a significant anomaly, not just a little, and it was a significant anomaly. And it was outside of the reach of the digital rectal exam. And that's something, too, as a patient, I didn't realize that, when the doctor told me that my prostate was nice and smooth, and I assumed that meant my entire prostate. Now that we had the results of the MRI, my new urologist recommended that I have another prostate biopsy, but this time we would target the anomaly. And then, I went in for that prostate biopsy, and then the results came back that confirmed cancer. And that's when I got that devastating news that, even though I'm healthy, no symptoms, no issues, I had cancer. So it was very difficult to process and comprehend. And it was quite devastating to hear that word, cancer.
Yeah. Certainly devastating news. So what was your initial reaction when you received the diagnosis of prostate cancer?
Well, when the doctor said cancer, my mind immediately shut down. I couldn't process anything that he was saying afterwards. Now, I'm sure he kept talking and telling me more about my diagnosis, but I just could not. I was not in a state of mind to process any additional information. And my mind immediately went to the worst case scenario, and I thought that I was going to die. I thought my life was over. I just wanted to curl up in a ball and hide. And reflecting on that, now that I've had time to kind of reflect on what I went through, I realize now that that was totally an overreaction. I didn't even know my Gleason score. I didn't even realize there was more tests to be done. I didn't realize there was many options to consider. I just went to that. So I almost needed some kind of emotional support at that time just to process and accept that I had it so that I could accept more information. So basically I had to go for more tests, a CAT scan, a bone scan, just to see if the cancer was contained within the prostate or not. But also immediately what came to mind was I wanted the cancer out. I wanted it gone, without really considering other options. And when I told this to my urologist that I wanted surgery, he immediately told me not to make a decision yet. He says, we don't even know if it's contained within the prostate. There's still so much work. And he wanted me to see a radiation oncologist. He wanted me to do my diligence and my homework. But looking back on that, I think I subconsciously already made that decision that I wanted that. So I wasn't as open as I believed that I was, even though I did look at other options. I think I was thinking I was going to have surgery anyway. So basically, after the bone and CT scan, the results of that indicated that the cancer was contained. And so all looked like it was contained. So with that news, I confirmed to my urologist that I wanted surgery. And he again, wanted to make sure that I was aware of all the different options and that I did my homework. And I was quite adamant that I wanted surgery. And although there was two specific potential side effects of surgery that I was most concerned with, and I talked to my urologist at length about those, and they, of course, are the urinary incontinence and the erectile dysfunction. And as far as the urinary incontinence, I understood that if I was to do Kegel exercises, that hopefully would help strengthen the muscles of the pelvic floor. So I started doing those immediately, even, way before the surgery. But I had really no way of knowing if they were actually effective or not, but I did them religiously every day. And as far as the erectile dysfunction, I understood that there was these two bundles of nerves that run along each side of the prostate that potentially could be spared if they're healthy looking and they're not invaded with cancer. And so my doctor said that he would do his best to preserve them, but he wouldn't know until he looked at them if they were unhealthy. And as the goal of the surgeon is to take the cancer out, and if those nerves appear to be cancerous, and they'll come out. So I took that risk and got an appointment date for my surgery. And I also opted for an open prostatectomy. I could have went for a robotic, but then I would have had to change urologists. And I had built up a rapport with my urologist, and I really trusted him. And that's something that I would say to all men is make sure you have a good rapport with your doctor, your urologist, your radiation oncologist, all of them. But so I trusted him and I felt comfortable with him. So I went with open, and that's what he specialized in. And so off I went and had my surgery.
So can you tell our listeners a bit about the recovery process with the surgery?
Absolutely. Well, I woke up in the recovery room and I actually felt great. I had no pain at all. I was alert, wide awake. And I was very anxious, of course, to speak to my surgeon, how things went. And then there he was. He came in to see how I was doing. And the first question that I had for him, I didn't ask him, how did the surgery go? Were there any complications? Did you manage to get all the cancer out? No, I didn't ask any of those questions. The first question that came to mind was, were you able to save my erection nerves? That was number one on my mind. And he, of course, laughed, and he said that he gets that question all the time. And he said that he was able to spare my erection nerves. He said they look very healthy. But he warned me. He said even though he spared them, they're traumatized, they're bruised, they may be damaged, and they may take several months or years to recover, with the possibility, even though they're there, they may never work the same again. But I was happy to know they were there at least. And so I was in the hospital for 2 nights, and I had a catheter for 2 weeks. Now, for me, the catheter was extremely painful. Now, most men have no issue at all with the catheter, but for me, it was extremely painful. And I'm so thankful for one of the nurses in the hospital. I told her that, the tip of my penis was extremely painful from the catheter. Maybe it was rubbing or something. And she said, I know exactly what to do. So she ran out of the room and she came back very quickly. And she had this tube of numbing jelly. And boy, was it ever a lifesaver for me. You apply a little bit of that, 30 seconds or so later, pain's gone. So no matter where I traveled with this catheter, I had that tube of numbing jelly with me all the time. Other than that, I really had no issue with it. But I did end up having it for 2 weeks. And normally, every case is different, of course. And normally it's 7 to 10 days. But mine was a little extra because I tried to recover too quickly. It's important to, no matter what treatment option men go for, it's important to respect the recovery process and to understand your body's gone through some kind of trauma and you're not going to be back to the way you were before. Now, I was very athletic and I was always exercising, and so I wanted to get back. And so I pushed the limits a bit too far, and I ended up fainting. And I was lucky my son was with me, and he caught me before I fainted. And my wife called 911, and most of it's a blur for me, but I do remember these two big, strong, muscular men coming in the door and very polite, asking me questions, taking my vital signs, and took me off to the emergency. And basically I just overexerted myself, and I wasn't drinking enough. I wasn't hydrated. And so very critical to not push yourself too hard. And do remember it, whatever treatment, is some kind of recovery required. So because of that, my urologist recommended keeping the catheter a little bit longer. So from there, basically, urinary incontinence was on my mind. I was a little worried. The day came for the catheter to be removed. I was, a little worried about what things would look like. So there I was in the doctor's office, and he deflated the balloon that holds it in the bladder, pulled it out, and I was lying on the table when he pulled it out. And I had to look. You have to look to see how things look and how bad is the leaking. And I was quite surprised at the moment anyway. There was no leakage, and I was quite happy with that. But I think that's because I was lying down and I wasn't really moving. But when I sat up, there was some leakage and also some burning sensation too. I was like, whoa. But overall, though, I've been pretty fortunate in that area. It really only took me about 6 weeks to return to full control. I have very good control now. And as a matter of fact, my flow is a lot better than it was before. And now, before, I said that I didn't have any symptoms, and maybe I didn't have any symptoms that I noticed. Yeah. But because my flow is much better than it was before, then perhaps that was a sign I didn't recognize. Maybe my flow over the years was getting worse and worse. I just didn't notice it. So I'm happy with that end. As far as erectile dysfunction, that's a lot more of a challenge. Now, my erections did return, but it took a good 17 months, and they're not as spontaneous as they used to be, and they're not always there when I want them to be there. They're just not the same, but they are there. So I'm kind of, I'm happy they're there when they're there, but they're not always there. But I have learned that there's a lot more to life than, than an erection. And also the relationship that I have with my spouse is very good, and she's very supportive. And so that makes things a lot easier. So here I am. I guess I'm 39 months out from surgery, and I'm feeling pretty good, feeling pretty healthy.
Well, we really appreciate you kind of going through that. That's going to be very helpful for our listeners to kind of get that perspective. And now, as far as following treatment, maybe can you tell our listeners a bit about what can a man expect in terms of follow-up as far as following the PSA and so forth?
The first thing, once my prostate was removed, the first thing my urologist said was PSA is produced by a protein from prostate cells. And they're produced by healthy cells, and they're also produced by cancerous cells. And when you successfully remove a prostate and all the prostate tissue, then there shouldn't be any PSA at all. Otherwise, there's potentially some PSA or prostate tissue left in the body. So about 6 weeks or so after my surgery, I had my first PSA test, and the goal of it, or what you're hoping to see, is what they call undetectable. And it's a level that basically means the machine is unable to detect any PSA. And so mine came back undetectable, and it actually has a reading, which is, for mine, it's less than 0.0008. And I think that all depends on the accuracy of the lab, whatever equipment that they use. But basically it means not detected. So for the first 2 years, my PSA was monitored every 3 months, just to ensure there wasn't, I suppose, in theory, if there was one prostate cell left in the body, it potentially could multiply over time. So my PSA has been undetectable steadily every time. So first 2 years was every 3 months. Now it's every 6 months. And then after 5 years, I'm going to be having my PSA tested only once a year. Although I'm not sure I'm comfortable with that. I think I would rather stay on the every 6 month schedule. It's just the recurrence is on your mind. I know that the chances are probably low, but recurrence definitely, especially every time it's time for a PSA test, I get a little anxious for the number.
Yeah. Well, it's certainly wonderful that your PSAs remained undetectable, but I can understand how it's definitely weighs on your mind each time you get that test drawn and waiting for the result. And
absolutely. I'm very lucky that the lab that I use here, I can check my results online, and they're usually available within 6 or 7 hours.
Wow, that's quick.
I feel pretty good about that. I know some men, unfortunately, they have to wait a few days and maybe even longer.
So now looking back, do you have any advice for men who have been recently diagnosed with prostate cancer and are, kind of in the situation of now weighing their options?
Oh, absolutely. The number one thing for me anyway was when I was diagnosed, as soon as I heard that word cancer, I went into the state of shock. Now, I didn't realize at the time I was in shock, only after reflecting on it that I realized that. And while I was in this state of shock, it's certainly not a good idea to make any decisions. You're not thinking clearly. You don't have all the information. So I would recommend that anyone who's diagnosed with cancer, everyone's going to react differently. Some men may not go in shock, but probably some level of shock. And you're going to need just a little bit of time just to recover from hearing the word cancer. So it's not a good idea to make decisions right away. Just take a bit of time to let yourself absorb that information and accept it so that you're able to move forward. And another piece of advice, especially in my case, is there's a lot of options out there. And it really depends on your specific case. And that's why it's so important that you understand your test results. You understand that you've had all the tests. You understand what options are available for you and what potential risks there are for those options and what potential side effects there are. And unfortunately, there's no one treatment that is best for everyone. I mean, that would be wonderful if there was, but just because one treatment works for one man certainly doesn't mean it's going to work for another. We're all at different levels, different ages, different health issues. So it's very specific and it's a very personal choice, but I would really like men to make the best possible decision for them. And the only way they can make that best possible decision is to make sure they give themselves a bit of time to recover from the shock of being diagnosed and also doing their homework and speaking with more than one doctor and getting different perspectives, before they make that decision, because it's a pretty important decision to make.
Well, I think that's certainly a wonderful advice for our listeners, and we appreciate that. And so kind of wrapping up today, any final thoughts today for our podcast listeners?
Yes. One thing that I didn't do right away anyways, I didn't join a prostate cancer support group. Now, I did, but not until after my treatment. And what I've learned is that most men are very, private, or they like to do things on their own. They like to solve their own problems. And I found that a lot of men actually go through treatment on their own. They pick a treatment, they go through it, and then only after their treatment, they join a support group. And if I had to do this over again, I certainly would recommend joining a support group even before you make your decision, just to realize that you're not alone. You don't have to go through this alone. And just the support and bonding with the other men. The prostate cancer support group, at first it was difficult for me to go there, and I understand what it's like to get a cancer diagnosis, and I understand that, you don't want to go in there and having people feel sorry for you and everything, but they're not like that. There's a bunch of great guys sitting around, and sometimes they don't even talk about cancer. They, talking about the ball game or something. So it's just a nice evening with the guys. So I certainly would recommend joining a support group as soon as possible.
Well, thanks for sharing that. And so for those that have not had a chance to read Gogs' book, Prostate Cancer Strikes, Navigating the Storm, you should definitely check it out. One of the ways you can access it is by just going to our resources tab on my podcast website at prostatehealthpodcast.com. And so we're really thankful, Gogs, again, for you coming on the show today. Really have provided significant value for our listeners. So thanks again.
Oh, thank you very much for the opportunity. It's my pleasure to be here.
All right. Well, thank you.
Thank you, Dr. Pullman.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/Prostate Health Podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.